people like me are focused. The only thing my father told us, my brother and I, when we left Lebanon, try to become doctors and be the best you can. Be the best you can.
George was with us since the beginning. His first year, he was the vice chair of the board. And then the next 9 years, he was the chairman of our board. He currently is a member of our board. And George is as passionate as the day is long, and he reminded us every day that we were only in business for one reason, and that was to take great care of patients. And he was relentless in that communication with us. You never had to question where the focus was, coming from the chair of the board, and I think that sets the tone for the entire organization. It wasn't a financial tone, it was a patient care tone, and that comes from a retired surgeon. Makes a lot of sense.
George brought that laser focus to the patient is the most important thing, and when you have that focus, everything else will fall into place.
Somebody had to stand up and say, boys, you better get shaped up. They're beating you everywhere else, in the city and in the state. There's nothing wrong by serving your patients like they were your own family.
I can still hear him say, Irene, it's all about the patient. Or, Irene, you and your staff never admitted a patient. The doctors admit the patients. My marching orders were always clear: to be fiscally sound, patient-focused, and respectful of our outstanding physicians.
If you went to the hospital today, every employee would know of that focus. And that's how George was able to translate his thoughts into action and results.
Patient doesn't care how much you know until they know how much you care.